question, a 42-year-old woman presents to the clinic with recurrent episodes of vertigo, tinnitus, and hearing loss in her left ear for the past 6 months. Each episode lasts for about 1 to 2 hours and is associated with a sensation of fullness in the ear. She denies fever, recent infections, or head trauma. Physical examination is unremarkable except for a positive Romberg test when she closes her eyes. Which of the following is the most likely cause of this patient's symptoms? A. Benign paroxysmal positional vertigo, BPPV. B. Vestibular neuritis. C. Meniere disease. D. Acoustic neuroma. E. Paralymphatic fistula. Answer C. Meniere disease. Explanation: this patient has recurrent episodes of vertigo, unilateral sensorineural hearing loss, tinnitus, and ear fullness, which are classic signs of Meniere disease. Pathophysiology. Meniere disease is caused by increased endolymphatic fluid in the inner ear, leading to swelling of the cochlea and vestibular system, endolymphatic hydrops. This disrupts normal signal transmission from the inner ear to the brain, leading to symptoms of vertigo, hearing loss, and tinnitus. Clinical features: classic triad, episodic vertigo lasting minutes to hours, sensorineural hearing loss, initially fluctuating, then progressive, tinnitus and ear fullness, affected ear. Diagnosis: clinical diagnosis based on episodic symptoms, audiometry, sensorineural hearing loss, low frequencies affected first, MRI, rule out acoustic neuroma if symptoms persist. Treatment: acute attacks, meclizine, vestibular suppressant, benzodiazepines, e.g. diazepam, antiemetics. Long-term management: low sodium diet, avoid caffeine and alcohol, diuretics, e.g. hydrochlorothiazide plus triamterene to reduce endolymph volume, refractory cases, intratympanic gentamicin injection or surgical procedures, labyrinthectomy, vestibular nerve section. Why not the other options? Option: why incorrect? A. Benign paroxysmal positional vertigo, BPPV, brief, 1 min, vertigo triggered by head movements, no tinnitus or hearing loss. Positive Dix-Hallpike test, vestibular neuritis, acute, severe vertigo, lasting days, but no hearing loss or tinnitus. Follows viral infection, neuroma. Causes progressive unilateral hearing loss and continuous imbalance, but no episodic vertigo. E. Paralymphatic fistula. Sudden onset vertigo and hearing loss after trauma or barotrauma, e.g. diving, head injury. Triggered by pressure changes, e.g. Valsalva maneuver. Take-home point: Ménière disease presents with recurrent episodes of vertigo, sensorineural hearing loss, tinnitus, and ear fullness due to endolymphatic hydrops. Treatment includes dietary modifications, diuretics, and vestibular suppressants. Would you like a question on